Hello everyone, my name is Ankita Mandal. I'm a BSc tutor at Sri Sri College of Nursing, Sri Sri University. So today my topic is causes and risk factors for developing illness. Let's understand the topic. Illness is a state in which a person's physical, emotional, intellectual, social, developmental, or spiritual functioning is diminished or impaired compared with previous experience. So we all have experienced fever, cold, or cough, and obviously stomach pain. When our body or mind is not functioning normally, we call it illness. Illness is a condition where a person feels unhealthy, physically weak, mentally, and socially. Unhealthy physically, mentally, as well as socially. For example, when a person have fever, body temperature rises, they feel weak, they cannot work properly. This is illness. We have acute illness, we have chronic illness, and we have objective versus subjective illness. Mostly we will focus on in acute and chronic illness. So what are the learning objective we will see over here? First, we will see first, we will identify the cause. Examine the biological, environmental, or physiological causes of various illnesses. Then we will assess the risks. We will differentiate. We will differentiate between modifiable and non-modifiable risk factors in patient care. Then we have nursing role. In different disease condition, we have different nurses' responsibility in health promotion and health prevention. We will go on to the next slide. Introduction. Developing an illness is rarely the result of a single event. It's usually a complex interactions between the agent, the host, and the environment. Nurses play a pivotal role in identifying these factors early to shift the patient from state of illness back toward wellness on the health continuum. So, developing illness is rarely a event of a rarely a single event. It is usually a complex interactions between the agent, the host, and the environment. In this, a nurses play a very important role to shift the patient from illness back to the healthy state. We will see the next slide. First, we have the cause, biological and infectious cause. Microorganisms are the most common primary cause of illness. They invade the host and disrupt normal physiological functions. For example, we have bacteria, we have viruses, we have fungi, and we have parasites. So why do we get infection? Because a tiny microorganisms enters our body. This living organisms are usually called microorganisms. These are of four main types. First, we will see bacteria. Bacteria rapidly dividing cells. Example, streptococci. So bacteria are the very tiny organism. Some bacteria are useful, but some may cause disease. For example, tuberculosis, typhoid, cholera. And another example we will see, if someone drinks dirty water containing bacteria, they may develop what? They may develop typhoid. Okay, then we will see viruses. Viruses are even smaller than bacteria. They enter the body cell and there they multiply. The recent example we all know is our COVID-19, flu and hepatitis. So these are the few examples of viruses. And for example, of person with flu sneezes, the virus spreads to the nearby people, and in the infection spread, and the other persons also get influenza or normal cold, cough, and fever. Then we will see fungi and parasite. Fungus grows in a warm and moist places. For example, ringworm, athlete's foot. For example, wearing a wet sock for a long time, that can lead to some fungal infection. Wearing a very tight shoes where there is no cross ventilation or no air passes, in that condition, that patient may develop ringworms. We can also see the ringworms in sometimes in the head and scalps. So these are the few examples of ringworms. Then we have parasites. Parasites live inside the another organism. For example, malaria. A mosquito bite can spread malaria parasite. So conclusion is microorganisms are the one of the most common cause of illness. And there we have modes, which it can be transmitted through direct mode or droplet or vector. For example, mosquito. Then we have environmental factor. In this, we have physical, chemical, and social environment. In physical factors, we will see the extreme temperature thing, the radiation, and the huge noise pollution can also lead to some severe illnesses. Then we have chemical, pesticides, heavy metal, lead, mercury, and the other industrial toxins. In today's fruits and vegetable, there is a huge content of chemical things which are pesticides, which leads to various type of diseases, sometimes cancers and other many stomach problem, esophagus problem, and many other oral problems. So these are due to what? Due to use of heavy metals and different types of pesticides in our food. Then we have social environment, where we face overcrowding, we have very poor sanitation, and we have lack of clean water. Whenever we will visit some nearby community areas, we will see that they practice a very poor sanitation process, and the lack of water, clean water is a problematic for them, which leads to different kind of diseases, because they do not practice a good sanitation, and bad sanitations obviously leads to different types of diseases. Next, we have genetic susceptibility. Non-modifiable risk factors are inherited or physiological attributes that increases the likelihood of illness. For example, genetics, family history of cancers or heart disease. Then we have age. Newborns or elderly have lower immunity. We see that newborn develops diseases very quickly as compared to a healthy adult, as well as in the elderly persons also their immunities are very weak, so they develop disease conditions very easily without they do not get much support from their immune system to fight with that particular organism. That's why the immunity power is very low, and the disease conditions tends to grow in their body very fast. Then we have gender. Certain conditions are sex linked. For example, osteoporosis in female after menopause, we tend to see many different types of hormonal diseases. One of them are osteoporosis. So some diseases are also gender based or sex linked. Also, in this, we can take another example. Some diseases run in the family. For example, diabetes, hypertension, breast cancer. If, for example, if both parents have